All right, welcome. Today we're going to break down a PLAB 2 station that, let's be honest, can feel a little intimidating, the scrotal swelling. But don't worry, we're going to build a super clear, step-by-step game plan. This isn't just about scraping a pass. It's about confidently showing those examiners you're a safe, competent doctor who can really nail this station and score top marks.
So here's our plan for today. We're literally going to walk through the consultation just as you would in the exam. We'll start with gathering info, move on to the exam itself, then figure out what's going on, and finally, wrap it all up with how to manage the patient. Sticking to this structure is honestly the secret to keeping your cool when the pressure's on.
Okay, first things first, let's talk about the challenge itself. You've got to remember, an OSCE isn't just a pop quiz on your medical knowledge. It's really a performance. You're demonstrating a specific set of skills to prove you're a safe and capable doctor in a live scenario.
So, picture this. The door opens, the timer starts, and all the instructions say is, you're an FY2, and your patient has a scrotal swelling. That's it. That's all you get. The clock is already ticking, and the patient is sitting there, looking to you for some real answers.
You've got 8 minutes. That's it. 8 whole minutes. And in that time, you have to do everything. Build that connection, get a solid history, do a sensitive exam, come up with a plan, and explain it all. I know, it sounds kind of crazy, but trust me, when you have a solid structure, it is absolutely doable.
And this is so important. The examiner is grading you on these 3 things. Everything you say, everything you do, from that very first question you ask to the final bit of advice you give, it's all got to be scoring you points in all 3 of these areas. The game plan we're putting together today, it's designed to do exactly that.
Right, let's dive in. Your history taking is the foundation for this entire station. If you nail this part, everything else just falls into place. And it's not just about firing off questions, it's about asking the right ones in a logical order.
Before you even get into the medical stuff, just start with some empathy. A simple phrase like this one makes a world of difference. It instantly puts the patient at ease, and it shows the examiner you've got great interpersonal skills right from the start. It's a small thing, but it's incredibly powerful.
Now, let's get to the lump itself. A fantastic little tool to make sure you cover all your bases is the MEDS mnemonic. Think of it as a checklist that helps you systematically ask about the swelling, so you don't forget any of the crucial details when you're under pressure.
So what does this actually look like in practice? You're just running through the key details, Which side is it on? How big is it roughly? What's it feel like? Is it hard, soft? Feel like there's fluid in there? Has it changed? When did it pop up? And the last big question is always, is it painful? Because if they say yes, boom, that's your cue. That's your perfect transition to dig deeper into that pain.
And if the patient does mention pain, your brain should just automatically click over to Socrates. You know this one. It's the gold standard for getting the full story on any kind of pain. Using it shows the examiner you have a really structured, thorough way of gathering information, which they absolutely love to see.
And here's how you go from focusing on the lump to thinking about the bigger picture. You have to ask about red flags. These questions are screening for the serious stuff, right? Like testicular cancer. Back pain could mean it's spread. Breast swelling can be a hormonal sign. Asking these questions proves you're thinking about the worst-case scenarios and that you're practicing safely.
Okay, let's switch gears to the examination. You've got your history, and now it's time to see if the physical findings match up. Now, with an intimate exam like this, your technique is obviously important, but how you communicate and respect the patient's dignity, that is absolutely everything. Now this, right here, this is a perfect example of hitting all 3 marking domains at once. You're managing the situation by suggesting the exam, you're showing amazing interpersonal skills with that gentle and respectful language, and you're setting up the technical part of the assessment. It's the perfect way to ask for consent.
The exam itself follows this really straightforward, logical flow. You start by just looking, inspecting for anything obvious. Then you'll gently feel or palpate to check its consistency and see if it's tender. Asking the patient to cough is your go-to for checking for hernias. And finally, percussion and auscultation can give you clues about what's actually inside the swelling.
Now, if you're trying to figure out what kind of hernia you're dealing with, Siemens test is a brilliant little trick. You can see on the left, you place your 3 fingers over 3 key spots, and the table on the right tells you what it means. If you feel the impulse on your index finger, it's an indirect hernia. Middle finger, direct hernia, and ring finger, down by the femoral canal.
And yeah, knowing the difference actually matters. An indirect hernia is the one that follows the normal path down the inguinal canal.
so you see it more in younger guys. A direct hernia, on the other hand, just pushes straight through a weak spot in the muscle wall that's more typical in older adults. Understanding this basic anatomy really helps you make sense of what you're finding.
All right, you've got the history, you've done the exam, now it's puzzle time. This is where you put all those pieces together and show off your clinical reasoning by connecting your findings to a logical list of possible diagnoses.
So just pause for a second and think about it. If you shine a light through the swelling and it glows, what does that tell you? If you feel an impulse when the patient coughs, what's at the top of your list? Or what if it feels like a bag of worms? Every single finding is a clue that's pointing you in the right direction. And this is basically your mental checklist of possibilities. Your history and your exams should help you work your way through this list, ruling things out and narrowing it down. Are we thinking it's a hernia? Or maybe a fluid-filled hydrocele? Or could it be the dilated veins of a varicocele? Keeping these in mind helps structure your thinking.
This chart is a great way to see the key differences at a glance. So notice how a hernia is the only one here that's going to have a positive cough impulse. A hydrocele, since it's just fluid, won't have an impulse, but it will transilluminate like crazy. It'll literally glow when you shine a light on it. And a varicocele, it has neither of those signs and is famously described as feeling like a bag of worms that might just vanish when the patient lies down.
We're on the home stretch now. You've got a pretty good idea of the diagnosis. Now you just need to close this station like a pro, showing safe management skills and amazing communication. You want to leave that patient feeling like they've been heard and properly looked after.
So here are the 4 non-negotiable steps to finishing strong. First, explain what you found in simple language, no medical jargon. Then, talk about the next steps, like any tests or referrals. This is crucial. Ask them about their ideas, concerns, and expectations. And finally, you have to give them clear safety netting advice on what to do if things change.
Okay, this part is huge. Safety netting is absolutely non-negotiable. It is one of the single most important things you can do to keep a patient safe, and it scores you massive points for clinical management. This phrase here, it's perfect. It's clear, it's confident, and it works whether you found something concerning or, in this case, you're just providing some welcome reassurance.
And really, this is what it all boils down to. The PLA of 2 exam isn't just about spotting a hernia. It's about managing a person, a human being, who is probably worried and feeling pretty vulnerable. When you prove that you can handle both the medical side of things and the patient's personal concerns, that's when you show you're a truly competent, caring doctor. That's all for now. Thanks for joining me.